Before adding kale to salads or smoothies, did you know about the surprising side effects and health risks associated with consuming kale? Let's find out the possible dangers that this seemingly harmless food poses to some health problems. Kale has gained a reputation as a nutritional powerhouse, celebrated for its high concentration of vitamins, minerals, and antioxidants. Although kale offers many health benefits, high concentrations of certain compounds in it can cause problems for people with certain health conditions. From interfering with medications and worsening kidney stones to affecting blood clotting and thyroid function, the effects of kale can be significant depending on your health status. It's important to research these potential risks in detail so you can make informed choices about adding kale to your diet. Join us as we explore the intricacies of kale consumption and its effects on various health issues. The number one blood clotting disorder, Maria, a 60-year-old woman on blood thinners, enjoyed kale treats until she suffered a dangerous blood clot and was told by her doctor that kale can have high vitamin levels affect his medication because he thought it was a healthy choice. A study published in the Journal of Thrombosis and Hemostasis highlighted that high levels of vitamin K can neutralize the effects of anticoagulants. Vitamin K is necessary for blood clotting, but too much of it can reduce the effectiveness of blood thinners, causing potential clotting problems. People taking blood thinners should be careful with kale, as its high vitamin K content can reduce the drug's effectiveness and cause clotting problems. If you are on anticoagulant therapy, ask your doctor for nutritional advice. We remind you that all scientific studies mentioned in the video are mentioned in the description. Number 2. Drug mixing. Mark, who was taking several medications to treat his chronic conditions, experienced side effects when he added cabbage to his diet. Mark has always been proactive about his health, but adding kale seemed to disrupt his well-being rather than improve it. The British Journal of Clinical Pharmacology emphasizes that high-fiber foods such as kale can interfere with the absorption and effectiveness of various medications. Kale fibers can bind to drugs in the gastrointestinal tract, reducing their bioavailability and effectiveness. If you are taking medication, remember that kale can affect the effectiveness of the medication, so the treatment plan must be changed. Discuss any dietary changes with your doctor to make sure your medications are still working effectively. I sincerely ask you to watch the video until the end, because at the end we give important information about how to safely and correctly consume kale to avoid related problems and only benefit from this food. Number 3. Kidney stones. John, a 45-year-old runner, suddenly felt severe stomach and back pain. She was diagnosed with kidney stones, which her doctor attributed to her high intake of oxalate-rich foods, including kale. John, who prided himself on his healthy lifestyle, was shocked to learn that his favorite chaste green juice, loaded down by the wagon, was contributing to his painful condition. A study published in the Clinical Journal of the American Society of Nephrology suggests that foods high in oxalate, such as kale, may increase the risk of kidney stones in susceptible individuals. Oxalates can bind with calcium in the kidneys to form hard stones that can be difficult to pass. If you are prone to kidney stones, it is wise to limit your kale intake to avoid painful stones. Instead, choose low oxalate vegetables and be sure to drink plenty of water to help flush oxalates out of your system. Number 4. Oxalate sensitivity. Laura, an athlete, developed joint pain after increasing her kale consumption. His nutritionist suspected oxalate sensitivity. Laura had been consuming large amounts of kale to increase her food intake, but instead she was struck by inexplicable joint pain and discomfort. An article published in Nutrition Research Reviews explains that high intake of oxalates from foods like kale can cause calcium oxalate crystals to form in the body, causing joint pain and other problems. These crystals can accumulate in joints and tissues, causing pain and inflammation. Those sensitive to oxalates should limit their intake of kale to avoid the formation of painful calcium oxalate crystals. To maintain a balanced diet without oxalate problems, consider other nutrient-dense, low-oxalate vegetables. Number 5. Iron deficiency. Vegan Sarah relied heavily on kale for her iron intake. Despite his efforts, he developed iron deficiency anemia, feeling constantly tired and weak. Sarah was careful with her plant-based diet, making sure she ate iron-rich foods like kale, but was confused when she still felt tired. An article published in the American Journal of Clinical Nutrition explains that while kale contains iron, it also contains compounds such as oxalates, which can inhibit iron absorption. Non-heme iron found in plants is already less bioavailable than heme iron from animal sources, and the presence of oxalates further reduces its absorption. For those at risk of iron deficiency, getting iron from kale can be harmful because it interferes with iron absorption. To improve absorption, combine iron-rich plant foods with foods rich in vitamin C, and if necessary, consider taking an iron supplement. Number 6. Autoimmune diseases. Emily, who was diagnosed with lupus, felt her symptoms improve when she started a kale diet. Her rheumatologist advised her to reduce her kale intake. Emily hoped that a nutrient-dense diet would help control her autoimmune disease, but instead she experienced increased inflammation and pain. The Journal of Autoimmunity discusses how certain compounds in cruciferous vegetables can stimulate the immune system and potentially worsen autoimmune diseases. These compounds can act as immune stimulators, increasing activity that can worsen symptoms in autoimmune patients. In people with autoimmune diseases, consumption of kale can cause flare-ups and worsen symptoms. Ask your doctor for dietary recommendations that won't make your condition worse. Remember that at the end of the video, we will show you how to eat kale correctly to avoid the problems associated with it and only benefit from this wonderful food. Number 7. Blood sugar spikes. Karen, a diabetic, noticed that her blood sugar level rose after a meal containing kale. Her nutritionist explained that certain compounds in cabbage can affect blood sugar regulation. Karen added kale to her meals and believed it would help control her diabetes, but her blood sugar levels became unstable. According to the Diabetes Care study, starchy vegetables are generally good for diabetics, but individual responses may vary, and some compounds in kale may affect blood sugar. Although kale is low in carbohydrates, its effect on blood sugar can be unpredictable for some people. Diabetics should carefully monitor their blood sugar by adding kale to their diet to avoid unexpected spikes. Work with your doctor to tailor your diet to your specific needs and consider other low glycemic vegetables. Number 8. Digestive problems. Tom, a 30-year-old fitness enthusiast, often suffered from bloating and stomach cramps after eating hearty meals. She later discovered that she was sensitive to FODMAPs. Tom was diligent about his diet and exercise, but couldn't understand why he felt so uncomfortable after eating what he thought was nutritious food. The American Journal of Gastroenterology notes that kale is high in FODMAPs, which can cause gastrointestinal upset in people with irritable bowel syndrome, IBS. FODMAPs are short-chain carbohydrates that are poorly absorbed in the small intestine, causing fermentation and gas production. If you have IBS or other gastrointestinal sensitivities, consuming kale can cause uncomfortable bloating and cramping. Consider low FODMAP vegetables and work with a dietitian to manage your symptoms. Number 9. Hypothyroidism. Anna, a 35-year-old mother of 2, struggled with fatigue and weight gain despite a healthy diet rich in kale. She later discovered that her symptoms were caused by hypothyroidism. Every morning, Anna mixed a kale smoothie, believing it would boost her energy levels and help her lose weight. However, he noticed that the fatigue was getting worse and the weight was increasing. Only after consulting a doctor did he learn about the goitrogenic properties of kale, according to a study published in the Journal of Clinical Endocrinology and Metabolism. Cruciferous vegetables, such as kale, contain goiter, which can interfere with thyroid function and worsen hypothyroidism. These goiters can interfere with the synthesis of thyroid hormones, preventing the absorption of iodine, which is essential for thyroid function. If you have an underactive thyroid gland, consuming kale can worsen your condition by preventing the absorption of iodine, which is essential for thyroid hormone production. It is important to balance your diet with other non-gotra vegetables and consult a health professional. Number 10. Food allergies. An 8-year-old boy, Liam, had a severe allergic reaction after eating kale. His parents were shocked to discover that he had a rare allergy to kale. Liam was enjoying a healthy kale salad when he suddenly developed hives and difficulty breathing, prompting him to rush to the emergency room. Food allergies to cruciferous vegetables, although rare, can cause serious reactions in sensitive people, according to a report in the journal Pediatric Allergy and Immunology. Allergies to kale and other vegetables can cause symptoms ranging from mild oral allergy syndrome to severe anaphylaxis. If you or your child has a food allergy, kale should be added with caution and under medical supervision. Be aware of possible side effects and contact your doctor if symptoms occur. Now, I will show you some important information so that you can consume kale properly to avoid the problems associated with it and get only the benefits of this wonderful food. Without this information, there would be no point in watching the video so far, so pay attention to it. Cure kale. Cooking cabbage can reduce its goiter properties, making it safer for people with hypothyroidism. Steaming, cooking, or slightly boiling kale helps to get rid of goiter. Balance with other vegetables. Include a variety of vegetables in your diet to ensure a balanced intake of nutrients. Rotating between kale, spinach, chard, and other leafy greens can prevent excessive consumption of either compound. To improve iron absorption, combine with vitamin C. Combine kale with vitamin C-rich foods such as peppers, oranges, or tomatoes. This combination can improve the absorption of non-heme iron and help prevent iron deficiency. Consider adding. If you need to limit kale for health reasons, consider supplements to meet your nutritional needs. For example, iodine supplements for thyroid health or iron supplements for anemia can help compensate for dietary restrictions. Listen to your body. Pay attention to how your body reacts to kale. If you notice any adverse symptoms such as swelling, joint pain, or changes in the effectiveness of the medication, it may be best to reduce your intake of kale or eliminate it from your diet. Choose organic if possible. Choose organic kale to reduce exposure to pesticides and other harmful chemicals. Organic cabbage may be a safer choice, especially for people with sensitivities or allergies. Kale is definitely a nutritious food, but it's not for everyone. If you have an underactive thyroid, kidney stones, blood clotting disorders, digestive problems, iron deficiency, food allergies, diabetes, autoimmune diseases, or take certain medications, consuming kale can be dangerous. Always consult a doctor before making any significant changes to your diet, especially if you have health problems. Stay informed and make the best choices for your well-being. By understanding these risks, you can make informed decisions about your diet. Remember that even the healthiest foods can be bad for your health. Be safe and put your health first in every dietary choice. If you want to know more about foods that seem to be 100% healthy, but somehow have side effects or health risks, I made this video especially for you. Understanding the nuances of diet is critical to maintaining overall health and wellness. Many foods, such as kale, that are touted for their nutritional value can interact differently with individual health conditions or medications. By exploring these complexities, you can more confidently navigate your diet and make choices that best support your health goals. In the video, we learn not only about the potential difficulties of consuming kale, but also about other foods that may have hidden deficiencies. From common misconceptions about certain vegetables to the impact of dietary choices on chronic disease, we strive to provide you with information to help you make informed decisions. Your health journey is unique, and understanding the complex connections between food and health can make all the difference. Join us as we reveal the truth about seemingly healthy foods and give you practical knowledge to effectively optimize your diet. Click here to watch the video now and deepen your understanding of how food choices can affect your health.